Joining us now, we have Gabriel de Silva, who we're going to speak to about the air quality issue that we've been facing across a number of our major cities. How bad has it been in terms of the standard of air that we're so used to having clean air in Canberra, Sydney and elsewhere, but it's been awful?
It has been. It's really been very low air quality levels across Sydney and much of New South Wales. But the other thing which we're really not used to seeing is that these poor air quality levels have persisted for a long time. So we've seen the smoke haze hanging around our cities for much longer than we would normally expect. And this is presenting new problems when we're trying to deal with reducing our exposure to unhealthy air.
One thing I'd be really keen to get your thoughts on is we've had a number of stories comparing the smoke to what is the equivalent of smoking a number of cigarettes per day. Is that a fair comparison to say that being in this level of smoke is the same as smoking a pack of cigarettes a day, whatever it is?
Look, it's not. It's obviously an analogy. It's not an exact comparison, but certainly what we know is that smoke is toxic. So there's no safe level that you can expose yourself to. So whether that's from cigarettes, whether it's from household fires, or if it's from bushfire smoke, we know that it's doing harm to your body, and it's particularly doing harm to young, developing lungs, brains, hearts, as well as to the fragile elderly and people that are prone to, that's sensitive to unhealthy air, so with asthma and other respiratory conditions.
Well, it's interesting. For moments like Saturday in Canberra, to speak of the experience here, where the air was perfect all day, and then it seemed a wind change, and then it's just blanketed the city and hasn't moved since. Is that basically what happens? That just the wind direction shifts, and then the city concerned cops it?
Absolutely, it's unpredictable. There are plumes of smoke that will move around at the whims of the weather. So you never quite know when you're going to cop it, as you say. And we also think about air pollution being an invisible problem. So even when you can't see it, there can be harmful compounds in the air that are affecting our health. So we're used to kind of clear blue skies, which can still have some negative health impacts from low air quality. So when you can see it and smell it, you know that it's going to be particularly bad.
Realistically, how severe would any long-term impact of being exposed to this smoke for a few weeks of the year have for any Australians over the long term?
It's really hard to say, look, these are the long-term impacts that will affect one particular person. But we know across a population of people that there will be increased negative health effects, whether it's from impacts on their lungs, on the circulation system, but we're seeing that these small toxic particles that penetrate into our lungs and into our bloodstream are having a wide effect on the body, and it's hard to predict it. It's hard to say, look, this is going to cause cancer in one person, this is going to impact the neurological development in one child, but we know on the whole, particularly when you're looking at big population centres like Sydney, that there will be negative health effects instantaneously. Yeah. So increased hospital admissions, but also over people's lifetimes.
Well, anecdotally, just talking to friends and family, that they're already having those sorts of doctors' checkups and so on because of immediate health ramifications. How do the city's experience in the last week or so compare to the cities of Delhi or Beijing?
So looking at a common measure of air quality, the Air Quality Index, AQI, which a lot of people in Australia were not familiar with but are now starting to read more and learn more about. We're seeing that on these measures, Sydney has been up there with some of the top 10 most polluted cities, which is a place where not used to being. We don't like seeing ourselves. And I think Australians kind of would expect to not have to deal with these conditions day in, day out.
Not at all. Gabriel Silva from the University of Melbourne, thank you so much for your insights.